Hello, I'm Dr. Kurt Woeller for the Toxicity Mastery course. The title of this short video is the TOX Detect Profile, and 2,4-dichlorophenoxic acetic acid was also called 2,4-D exposure. So within the Toxicity Mastery course, one of the labs we cover is the TOX Detect Profile. Now, this particular urine profile comes from Mosaic Diagnostics. It's evaluating many different types of environmental chemicals. It's important to understand that there's many associated symptoms that can occur with different types of toxic chemical exposures, as well as different types of health conditions and diseases. So the only way to know whether someone is being exposed and to what exactly they're being exposed to is to test for it. Otherwise, it's just assumptions and guessing. And it's important to understand that certain exposures can be highly clinically significant. So, certain pesticides, phthalates, other types of organic compounds like vinyl chloride, styrene, benzene, and then things like perchlorate and acrylamide all have different types of chemical influences. Some of these things are carcinogenic. Organophosphates, for example, are commonly detrimental to the brain and nervous system. And the test is very comprehensive in how it presents information. So we have a summary of elevator results for a quick glance, and then you can get more into individual levels that are elevated with more specific information through the interpretive paragraphs as to common exposures to a chemical and what are some associated health conditions. So, an example of this, and something that we often see elevated on these tests, is this 2,4-dichlorophenoxic acetic acid. What's interesting about this particular compound is that it was once used in the Vietnam War in what was called the Agent Orange campaign to cause deforestation. It is a common herbicide now used around the world in both agricultural and landscaping. Sometimes it gets combined with glyphosate. And chronic exposures, even to low levels of 2,4-D, have been associated with potential health effects. So it can disrupt the endocrine system, reproductive influences, developmental problems, and there's also an increased risk for non Hodgkin lymphoma. Many times on the Tox Detect profile, you'll see 2,4-D elevated along with things like organophosphates, which have their own unique toxicity, particularly within the brain and nervous system. So there's individual toxic effects of these chemicals, and then there is combination effects. And so again, it's the combination effects which are equally, if not sometimes even more detrimental than the individual compound itself. But that depends on dose and duration of how long the exposure has been going on. And if we look at some of the mechanisms of 2,4-D, we can see in this particular slide that 2,4-D affects ion flow essentially across the cell membrane. And that can be detrimental in many cells, but particularly the brain and nervous system, where we need electrical influences to send a nerve signal. It can also influence the oxidative stress or the oxidative influence of what's called the cytosolic fluid, and that can damage other types of organelles that exist within a cell. And then it's also directly toxic to mitochondria. If we affect mitochondria adversely, we're going to affect the ability to make ATP, the cellular energy currency chemical, and that as well will compromise different types of organ system: brain nervous system, cardiovascular, immune system, musculoskeletal system, etc. And with regards to this particular chemical, there is many different types of problems that can occur, but one of those that's important to understand is the adverse effects, again, of the brain and nervous system. In amyotrophic lateral sclerosis, what's also called Lou Gehrig's disease, has been associated or is associated with 2,4-D exposure. So, common symptoms of 2,4-D exposure would be weakness, nausea, abdominal pain, headache, dizziness, as well as peripheral neuropathy, seizures, brain damage, and impaired reflexes. So, again, the TOX Detect profile, as one of the chemical tests that we discuss in the Toxicity Mastery course is a very important profile to understand how to use and interpret for different types of patients. So I'm Dr. Kurt Woeller. I have been in clinical practice now for almost 3 decades, and also been a clinical educator for Mosaic Diagnostics Laboratory, which was formerly Great Plains Laboratory. I'm founder and clinical education director for Integrative Medicine Academy. I'm also founder and education director for Autism Recovery System. I have a podcast called Functional Medicine Doc Talk, and I am one of the main contributors and lecturers through Integrative Medicine Academy. Now, the Toxicity Mastery course is taught by me, as well as my partner, Dr. Tracy Trancatella, who is a naturopathic physician, and she does a very comprehensive lecture on different types of detoxification strategies for individuals related to the concept of toxicity and toxin exposure. So, for more information about the Toxicity Mastery course, you can go to toxicitymasterycourse.com. You can also email us with questions about content of the course at toxicitymasterycourse@gmail.com. Again, I'm Dr. Kurt Woeller for the Toxicity Mastery course. Thank you.